Welcome to the model of the ear. One of the things you might notice first off is the portion of the external ear. The external ear is referred to as the auricle. The auricle. You might recall that the external auditory canal travels through the temporal bone of the skull. This is a portion of the temporal bone. We will remove that to expose the external auditory canal. The ear has three regions: the outer ear, the middle ear, and the inner ear. The outer ear is composed of the auricle and the external auditory canal. So the auricle and the external auditory canal. The external ear ends at a structure called the tympanic membrane. The tympanic membrane. The tympanic membrane is going to vibrate as sound waves enter the ear through the external auditory canal. The middle ear is composed of the three ear ossicles. Ossicles means little bones. In this model, I can take out the tympanic membrane and I can see the structures more clearly. So keep in mind that the tympanic membrane is actually the border between the external ear and the middle ear. The structures of the middle ear are going to include the opening to the eustachian tube and the three ossicles. So let me show you what those ossicles are. One of the ossicles is attached to the structures of the inner ear. The other two are attached to the tympanic membrane. The three ossicles are called the malleus, the incus, and the stapes. Sometimes this is referred to in English as the hammer, anvil, and stirrup. The order in which these ossicles go is MIS, so you want to make sure you don't miss the question. The first bone that is attached to the tympanic membrane directly is the malleus. The malleus. The malleus is then attached to the incus. This portion of the incus is going to make contact with the stapes. The function of these three ossicles is to amplify the sound, because having this membrane move in the air is not very difficult. But once we translate this information that is in an air medium to inside of these chambers, which has a liquid medium, we need a lot more force. So we use this trick of these three levers to amplify the sound so that I have more force here at what we call the oval window. The oval window. So we've got the malleus, the incus, and the stapes. The malleus, the incus, and the stapes. Now, the innermost portion of the ear, or the inner ear, is made up of both the cochlea and the vestibular apparatus. So this is the stapes. The stapes is part of the middle ear. Everything else that we see here is part of the internal ear or inner ear. The stapes is connected to the oval window. The oval window is connected to the base of this structure here called the vestibule. So this entire structure here at number 13 is the vestibule. But this is the vestibule here, the base of this structure here. Now, when the stapes is displacing fluid within these chambers, the fluid needs to have somewhere to go. There's no air in these chambers, so there's no room for displacement of the fluid. At 16, we have the round window. The round window is going to bulge along with the depression and the vibration of the stapes here at the oval window. As this is moving up and down, this is going to be displacing liquid within this structure here that looks like a shell. This structure is called the cochlea. The cochlea has hair cells that are going to respond to the sound. Our highest pitched sounds are actually sensed by hair cells, which are located more towards what we call the base of the cochlea, which is here. The lower pitched sounds, interestingly enough, are sensed further along towards what's called the apex of the cochlea. For this reason, we see age-related hearing loss with the top high end of our frequency being what is lost first. The reason for that is just fatigue with age. So if you go to an audiologist, what is considered normal is going to depend on your age. The hair cells are going to respond to certain frequencies, and only those hair cells within that frequency are going to vibrate. The strength or the volume is going to be depicted on how much or how strongly the stapes is being pushed. So the information from the cochlea is then sent through the vestibulocochlear nerve, and that is then going to go to the brain for perception. We also have another sense here, which is our vestibular senses or the vestibular nervous system. The vestibule is located here. Within the vestibule, we have the utricle and the saccule. Within these structures, we get our sense of linear acceleration. In other words, if you were falling out of an airplane, going up in a rocket, or if you are traveling horizontally, maybe you're in a car and you slam on the gas first and then slam on the brakes. But when you're doing that, you actually have these little rocks inside of the chambers of the utricle and saccule. And as those rocks are moving, you have hair cells within those chambers. And those hair cells are giving you that sense of acceleration or falling or accelerating quickly upwards and so on and so forth. The other portion that we have of the vestibular system here are the three semicircular canals. Now, the semicircular canals are going to give us our sense of rotation. So we actually have crystals that are located within each of these three semicircular canals. We have three of them. We've got the anterior, posterior, and lateral semicircular canals. And each one of these is in a different plane of orientation. So you can think of this as one on each of our three dimensions of existence. One on the X plane, one on the Y plane, and one on the Z plane. And these are going to give us our sense of rotational acceleration. If you're nodding your head yes, shaking your head no, or putting your head on your shoulder either side, those would be the three planes of motion. And everything in between would just be a combination of what these three semicircular canals would sense. And then perception would happen at the level of the brain. Both the information from the cochlea and the vestibule, along with the semicircular canals, that information goes from this apparatus to the brain through the vestibulocochlear nerve. The vestibulocochlear nerve. One more thing I want to mention here is the eustachian tube. The eustachian tube, also known as the auditory tube, is an opening to allow for the pressure to equalize between the middle ear and the pharynx, which is the throat. So this is what sometimes gets plugged up, especially if it's a baby and the baby has a sinus infection and is up in an airplane. It can be very uncomfortable and maybe makes the baby fussy. This is also what you might feel if you are taking a trip up to Big Bear. You might notice that, oh, my ears need to pop. Okay, so this is due to the eustachian tube or auditory tube. So it equalizes the pressure between the middle ear and the outside environment. Thank you for watching.